Postpartum visit usually happens 6 weeks after delivery. There's a lot of things to be covered at this visit, both about the mother and about the baby. We always start with greeting and also congratulating patients on being a new mother, and we ask about how she's doing and how's the motherhood. Mostly, some patients have some concern about some issues. For example, if there's any concern about breastfeeding, if there's any tiredness. So we want to make sure that we start with eyes. Is there anything in particular that is concerning you? And then we go on to check all the issues that we want to check at this visit. So, after asking patient about eyes, and especially concern, and addressing the concern, we want to make sure that we check everything else off the list. We ask about the baby. Usually we can visit baby at another session. So we can just ask quick questions about how's the baby, how's the feeding, how many wet nappies the baby have, or is there any concern regarding the baby? So we can see her now or see the baby at another session. About the pregnancy, if there's been any problem with the pregnancy and during the delivery, what was delivery? Was it a vaginal delivery or a C-section? Was there any problem during any of those? We want to consider if the patient has any sign and symptom of anemia and hypothyroidism, which can happen after delivery and is quite common. We check episiotomy or C-section cuts. We ask about the breastfeeding, if patient is breastfeeding or using formula. If there's any problem that can happen with breastfeeding, such as pain, engorgement, mastitis, cracked nipple, and abscess. Then we ask about vaginal bleeding and discharge. We don't expect the patient to have any bleeding or discharge at this point. We ask if the patient has started sexual activity because it's very important to address contraception at this point. Checking patient mood is really important because postpartum depression is very common. If we have any problem and we think that the patient is depressed, we can go on and ask about any thought on harming themselves or the baby. We can consider giving the patient Edinburgh questionnaire. Always ask about domestic violence. As with the pregnancy, it can happen very commonly, so make sure you don't miss that. You can normalize that by saying that I always ask any of my patients after delivery this question. So I want to know, by any chance, has there been any problem in your marriage or any problem with your partner? Has he ever been violent to you in any kind? Then we can go on and ask patient about any back pain, any constipation, which is actually quite common at this point, and any problem with waterworks, such as burning on urination. Then we want to ask if the patient has any plan on going back to work, going back to studying, if the patient is able to drive or not, or if there's any plan in the future.